Hello, everyone, and welcome to today's webinar. My name is Trevor. I'm the Communications Manager for the Canadian Cancer Survivor Network. Thank you for attending today's webinar. If you're new to the webinar series or to CCSN in general, we are an organization working with cancer patients and survivors to learn about the complexity of our health system, connect with others to plan action, and act on those plans to create better outcomes and healthy survivorship. Please visit our website, survivornet.ca, to find plenty of information like news and events and other information. Now, this webinar will be recorded and will be available on YouTube, and a link will be provided by the email that you registered with. We will add a quick Q&A session at the end, but if you would like, put your questions into the chat below, and at the end, we will read those questions, and you can see the chat function at the bottom of your screen. Now, to present today's webinar is Dani Taylor. Dani is the Manager of Programs and Partnerships at Young Adult Cancer Canada. Dani is an oncology social worker and a young adult colorectal cancer survivor. She has completed her master's in social work with the Factor-Inwentash Faculty of Social Work at University of Toronto, as well as her Bachelor of Social Work and BA in English Literature with York University. Her experiences with the healthcare system and support of Young Adult Cancer Canada led her to explore a career in physiological oncology, finding particular interest in illness narratives and systematic violence. Dani has previously worked for Gilda's Club Greater Toronto, where she continues to facilitate their 20s and 30s support group, Sunnybrook Health Sciences Centre, palliative care, and the Princess Margaret Cancer Centre, to name a few. Without further ado, then, I would like to turn it over to Dani to present Young Adult Cancer Canada and the 8 things you need to know about cancer in the prime of your life.
Thank you so much, Trevor, and thank you everyone for being here today. Thank you, CCSN, for inviting me. I am worried that maybe autocorrect caught me in my bio that I gave to Trevor there. So I'm certainly not an expert in anything physiological. I want to put that out right away. Psychosocial oncology is where I find my home and expertise. It's so great to be here with everyone. So I'm here to talk to you today about 8 things that you need to know about cancer in the prime of your life. So let's just go ahead and jump right into it, because there's a lot to talk about within these 8 things. So let's give just a little bit of initial context so that we all are kind of like thinking about this population, maybe using the same points of reference. So we often think about adolescent and young adult population, commonly kind of short-termed as AYAs, and I'll likely do that throughout today's conversation as well. We think about them as a forgotten generation. Who are they? There are so many different ways to define this population. So once you start kind of like Googling, researching, what have you, everyone has their own definition, but I would say the most dominant is folks that have been diagnosed with cancer between the ages of 15 and 39. So a lot of kind of establishing stuff during those years, if you get to think about like all the diversity of experience there. At YAC, so we accept anyone that's had a diagnosis before the age of 40. So that does include young adults that are pediatric oncology survivors. And if you're currently between the ages of 18 and 40-ish, that means you're eligible for our programming. So within Canada, you're looking at over 8,000 AYAs diagnosed with cancer annually. And within Canada, we're estimating that there are over 200,000 young adult survivors living with and beyond their diagnosis in this country. So got a little bit of my intro off the top, so I'm going to breeze through this really quickly. So I'm currently the Manager of Programs and Partnerships at Young Adult Cancer Canada. Most of my experience has been in social working, in oncology and palliative care spaces, in both hospitals and community spaces. I still spend quite a bit of time with Gilda's Club as well. And I have a real interest in building peer connections and community building, especially for AYAs. And a big part of that, as Trevor alluded to, is my lived experience. So I have a real kind of personal context that brought me to this work. So I thought I'd maybe use a bit of my experience to share with you the journey that Young Adult Cancer Canada, or as I'm probably just going to refer to them going forward as YAC, and their relationship with research and how these things have kind of like come together. So my before of things. I was in my early 20s, doing something totally outside of the oncology space, was very, I would say, removed from any idea of cancer. It was nowhere on my radar. It was something that I kind of understood happened to mostly older adults. It was something that was not at all on my radar. And it took a while to get my diagnosis because I was so symptomatic, but facing many of the challenges within the healthcare system that many young adults do. Didn't have a regular family doctor, didn't quite know what to look out for, all of those different things. So it was quite a surprise when at 23 years old, I was diagnosed with stage 3 colorectal cancer. And probably a bit more of a surprise as to like how long and how much that would change my life. And so I remember being quite shocked that it wouldn't take a semester to get through, which is what I was hoping to schedule it for. And then it actually ended up taking the acute treatment of it all a little over a year to kind of move through. During that time, I received some supports from my hospital system at the time that was over in London, but was largely isolated. I had some like good friends and family that were there for support, but I didn't have connection to other young adults like me. I do have a memory of accosting a young woman in the waiting room of the chemo lounge, but it turns out it was her parent that was there for treatment. And I kind of, I think, felt this loneliness and knew that I needed peer support for a long time, but I didn't know how to get started with it. And when I finished treatment and life didn't fit back on the way that I was expecting it to, that is when I would say was my hardest chapter when I'm looking at my emotional piece of that journey. And that is when I happened to connect with YAC on a real whim. And that experience for me was really revelatory. It was the first time I found support that I felt like fully understood me. And there was so much validation, even in just a few first minutes of coming together, even though many folks didn't share my exact diagnosis. There was such a diversity of different diseases and stages of life and so many other kind of like aspects that made us different, but we had this shared tissue of being young people moving through something totally unexpected. And this totally shifted my point of view. It shifted the direction of my life and brought me into pursuing social work and oncology support, and really, I think, community cancer care in a different way. And so learning about my community and our shared needs has been a real passion of mine. And one of the ways that I've done that over time is I've participated in research to help kind of grow the evidence that's out there and change some of the status quo. There was so much that me and my peers were recognizing was shared between us that wasn't reflected in the research that was out there or didn't fit the context. It was maybe stuff from another country, or it was focused on a smaller subset of the ages or what have you. So it felt like there weren't the right tools and pieces of evidence out there for the healthcare system to adapt to our needs. So let's talk about YAC. So I'm newer to the YAC team. So this is, while I've been connected with them for many years now, this story of how they started to do research as an organization gets started not too far after I first met them at a retreat. So for YAC, they were receiving like about 4 to 5 research recruitment requests within a month. And it was awesome to help with the recruitment of it all, but YAC was getting hungrier and hungrier to take a more active role in AYA research and making sure that the needs of our community was being reflected, and using the expertise that we were gaining from having so much time and trust with our community to make sure that the research was fitting for what our community really needs. And so in September of 2015, Jeff Eaton, our executive director, and my program director, Corrine, met with Dr. Sheila Garland, and Sheila really helped open up a lot of possibilities to YAC as far as research went. And the biggest thing is something we call YACPrime, which you might be familiar with. So YACPrime here are some amazing folks that have been involved with this. So it grew and grew and grew, you might see, from all across the country, and even some folks from abroad helping out with this massive research project. So if you're in the audience today, or you happen to see this, or if any of these folks are familiar, please give them a quick shout out and a thank you for the work that they've done on this. But let's talk a little bit more about like what is YACPrime. So I'm talking about it kind of vaguely. So YACPrime is a national cross-sectional survey of 622 young adults with cancer. And what happened within the study is there was clinically relevant patient-recorded outcomes that were measured on sleep, body image, distress, fear of cancer recurrence, coping strategies, social support, and post-traumatic growth. And this was all done using an online survey. So participants needed to be between that age range of 15 to 39. They needed to currently be 19 years old. And other than that, we were pretty open on eligibility because we wanted to get as many voices to the table as we could. And we made it available in both official languages. So this little map here, oh, it's a bit cut off. I'm sorry. Atlantic Canada. That's actually where I am in St. John's. It was just showing a bit of like the representation from across the country, and that we did have voices from all over. Sorry to cut that off for you folks. Let's talk about the research questions, and then we'll get into some of these findings. So first research question, what is the lived experience of cancer in young adults, and how does this impact their psychological, physical, and interpersonal well-being? So several important areas of functioning were assessed in that: sleep, body image, distress, fear of recurrence, coping strategies, social support, and post-traumatic growth. And number two, how do these levels of distress and social support in young adults with cancer compare with age and sex with matched peers without cancer from the Canadian Community Health Survey? So this allowed us to better understand and communicate how cancer might be different for young adults. We hypothesized that young adults with cancer would have more stress, that stress would be independent of the level of support that they had. And finally, there's the frequency and intensity of contact and support from YAC network, like being able to get this like peer support stuff going. Does that influence the psychological outcomes? And we hypothesized that individuals that reported more frequent and intense contact with YAC support and programs would be experiencing less fear of recurrence, post-traumatic growth, and use more effective coping methods. So this is something we've said at Young Adult Cancer Canada for a long time, that it takes longer to recover from cancer than to be treated for it. And that was something that we were really picking up at a lot of our retreat programs and conference programs and all of these opportunities where we're meeting young adults over time and hearing about how hard it is, and even the after, even the part that we are so looking forward to in the acute phases of treatment, to being done, and how complicated and messy and long the shadow of cancer is. Even more so for folks that are living with chronic or metastatic disease, this like idea of recovery and its holistic impacts on our lives, and that being maybe not so tied all the time to just the physical impacts or the biomedical impacts, but looking again at this whole picture. So this is something that we've been saying at YAC forever, but finally, we have a little bit of evidence to show you that like this is scarily true. So let's get into it. The 8 things you need to know about cancer in the prime of your life. And so first, let's start with quality of life. So for those that aren't able to see the screen, I'm just going to read out what's shared in front of me in a little image. More than 6 years after treatment, 50% of young adults reported poor mental health. So our participants rated quality of life subjectively in relation to their overall feelings of physical and psychological and social elements of life. The data reported here is for YAC Prime participants that were more than 2 years from the completion of their treatment. Quality of life is massively disrupted from AYAs when compared to their peers not diagnosed with cancer. I don't think that'll be surprising to too many of us. In YAC Prime, we observed that the young adult survivors of cancer showed significantly worse physical and mental health ratings when compared to their peers that had not received a cancer diagnosis. The factors associated with poor quality of life include sleep, fear of cancer recurrence, body image distress, and a need for social support. And in our sample, 49.7% of participants who were more than 6 years from the completion of cancer treatment reported poor mental health, and 31.8% reported poor physical health. So what can health professionals and systems do? So increasing availability and access of survivorship and psychosocial supports for young adults is key. And assessing and intervening on sleep, fear of cancer recurrence, body image, and social support kind of needs to be a must. So what has YAC been doing in that? So across our programs, which are available currently primarily virtually, historically more in person, we're getting a little more into the in-person space, but with caution. We like to address quality of life concerns across all of our programs, especially in the psychoeducational content that we make available to folks. I'll get more into that a little bit later. Let's talk about number 2. Psychological distress. So 1 in 2 young adults experience significant symptoms of depression or anxiety. Psychological distress describes the collective experience of our depression, anxiety, and related symptoms. Our results showed that 46.7% of participants experienced moderate to severe distress, with 26.7% reporting severe distress. And when compared to their matched peers without cancer, we also saw a significant difference as illustrated in this image. So body image dissatisfaction and fear of cancer recurrence and poor social support were all associated with high levels of distress. And we also explored the relationship between distress and the setting. So the support in both rural and urban young adults. And we found that those living in rural centers were in more distress than those living in urban centers. It's a quote from Joseph, who was diagnosed with cancer at age 20. Wondering how long you have to live leaves you constantly anxious and depressed because you feel powerless. Something has stepped into your life and basically taken over. Survivors still do their best to navigate around these issues, but with little support. So again, let's talk about what can be done. So health professionals and systems can adapt existing interventions for older adults experiencing cancer-related distress. We can expand access and limit barriers for AYAs regarding this setting issue, right? So let's think about virtual. Let's think about how we've been able to pivot in these last 2 or 3 years. And let's make sure that we're still prioritizing making this space available. What about collaboration to increase system capacity? So we're seeing, again, this long shadow of distress. And I think many folks are aware of the demands on our healthcare systems right now. So what can be done as far as being able to refer and collaborate and make sure that folks are moving through the system and also getting support on the other side so that they're able to get the care they need in this longitudinal way? So what has YAC been doing? YAC, again, has been offering many opportunities for young adults to find meaningful peer connection to support their mental health and relieve distress. So one of my favorite ways that we're doing that right now is through a program called YAC Chats. So those are peer facilitated open groups. I facilitate a few of them here and there. And then we have some incredible peer volunteers that lead these conversations and provide space to explore many different topics and get a little bit of relief and validation from so much of this distress that comes with us from just feeling isolated and alone. Let's talk about fear of cancer recurrence. So that's a pretty scary stat there. 1 in 6 young adults report spending hours every day worrying about a cancer recurrence. So put that in perspective into your day, for example. What do you spend hours worrying about? What's with you all of the time almost? So young adults with cancer show persistent distress and anxiety that their cancer will recur and uncertainty about future health. In our study, a whopping 59.2% of participants reported experiencing clinically significant fear of cancer recurrence. The factors associated with greater fear of cancer recurrence are time since diagnosis. So the more recent your diagnosis, that higher your feeling of fear of cancer recurrence is going to be. If you've had a previous recurrence, of course, that you are going to feel all the more fear of cancer recurrence. If it's happened before, of course, it's so valid to feel worried that it will happen again. Distress. So if you're already heightened in other areas, if you're experiencing moderate to severe distress, it's going to likely mean a relationship with severe fear of cancer recurrence. And body image dissatisfaction was also related to higher fear of cancer recurrence. So these 8 things are actually quite interwoven, is something that we've found. So this is from another community member, Nicole, who was diagnosed with cancer at age 25. With every new lump, bump, or feeling of exhaustion, fear of cancer is the first thought that comes to mind. Once diagnosed with cancer, there isn't a day that goes by without thinking about it. So what, again, can we do? Adapting existing fear of cancer recurrence programs and making them specific for AYAs in their life stages, acknowledging the difference. Making sure that AYAs have access to information about their disease through safe and supportive sources. It's not uncommon in our community, and I think, to be honest, in many cancer-related spaces, to joke about Dr. Google and to talk about that, miserable experience of being up at 3:30 in the morning, looking at prognosis stats or what have you. I've been there. That's why I'm referencing it. And it's, again, also not uncommon for you to maybe raise these concerns and worries to your care team and be waved off, to be told not to worry about it, to not focus your time there. But I think it's very important that AYAs have access to their health information, that they have a good understanding of where their risks may be, and so that they can kind of prepare or suit themselves appropriately. So what has YAC been doing? So we prioritize a lot of space and education to normalize fear of cancer recurrence. That was something that, for me, I would say was really key when I first got connected with the organization as a service user. Fear of cancer recurrence was something that I was certainly experiencing, but I'd never heard anyone else talk about before. And I felt almost like completely locked in by this fear at times, as far as my ability to make decisions. Was I going to go back to school? Was I wanting to, get married? What about like these eggs I have on ice? So many complicated questions that this other big question looms over you around, well, what if it comes back? And so YAC has been, I think, really phenomenal in making space to talk about fear of cancer recurrence in many different forms. I want to talk next about sleep. 86% of young adults diagnosed with cancer reported poor sleep quality. So the seriousness of sleep, specifically sleep disturbance, and what that can have on the health of young adults diagnosed with cancer is often overlooked in research and not addressed enough in psychosocial care. For example, lack of sleep can impact mood, physical health, relationships, cognition. There are very few mental health or emotional challenges or diseases, what have you, that don't have some impact of sleep involved there. So think about this relationship with sleep and our overall well-being. And the YACPrime study found that 86% of young adults diagnosed with cancer reported worse sleep quality, which is significant and troubling. And for those more immediately after their cancer diagnosis, 52% of them are likely to have difficulty falling or staying asleep. Sleep medication use was reported by 44.5% of that sample, with 20.6% reporting using these medications 3 or more times a week. And it was found that survivors that had greater years of education reported having better sleep quality and those with less. It was also found that survivors in school reported better sleep quality than those neither working nor in school. Survivors 2 to 5 years post-treatment reported better sleep quality than those less than 1 year post-treatment. Clinically distressed survivors reported worse sleep quality than those who were not clinically distressed. And survivors in good physical and mental health reported better sleep quality than those in poor health. This is from Zoe, who was diagnosed with cancer at age 21. I really wish someone would have told me about how important sleep was for my cancer recovery and offered me support for it. I'm 3 years post-treatment and don't think I've had a decent night of sleep since my diagnosis. It has impacted many areas of my life and my family, my friends, my work, and my health. What again can we do? You need to ask about sleep. you're a care professional here in the audience, you got to ask about sleep. If you're somebody in the audience that has lived experience of your diagnosis and you are not being asked about sleep, bring it up. Even after this, like maybe acute phase of treatment might be closed, if your sleep quality is not good, we need to talk about it. Treating sleep with the essential foundation it is for both mental and physical wellness. What have we been doing, YAC as an organization? So we, again, regularly feature education on sleep health within our website and our community. And we continue to partner with experts like Dr. Sheila Garland on research and knowledge translation. So for those not familiar with Dr. Garland's work, fantastic psychologist on sleep, on sleep health. And so she's been a great partner in really opening up this world for our population and for our organization. Let's talk about body image. Ooh, I could talk for a full hour on this alone. Body image distress can be experienced by all people of all ages, regardless of a cancer diagnosis, but it is quite prevalent challenge within the young adult cancer community. When diagnosed with cancer, the body goes through many changes, from hair loss, weight fluctuations, scars, skin conditions that can affect how the body's perceived and how one feels in their skin. And yet, body image concerns are often overlooked and rarely discussed with young adults with cancer. The YACPrime Study showed that higher body image concerns were related to less time since diagnosis, makes sense, lower post-traumatic growth. So if your body image is really high, it's maybe going to be able to, impede your ability to get that other side of that trauma coin, the growth piece, where through these hard experiences that we wouldn't have chosen or opted into, we can actually find some really beautiful changes and adaptations and resilience for ourselves. Higher body image distress was also linked with those that had greater overall distress and a higher number of treatments received. Body image concerns were also higher for those currently on treatment. 68% of young adults diagnosed with cancer report significant stress about their body image. So another quote from Nicole. Body image is an issue people don't think of when going through cancer. We either gain weight or lose weight because of the side effects of many drugs. We have to say goodbye to our hair, eyebrows, and things that make us blend in with everybody else. And no matter what, you will have a new battle scars that you need to learn to love. Again, from Nicole, diagnosed with cancer at age 25. It's a quote that's very resonant for me. Body image was quite a journey, continues to be. I'll own that. I know from my treatment kind of path and journey, because of the location of my tumor, I had a long period where I wasn't really able to eat food in the way that I do now, or that many of us do. It was boost and ensure, or bowel blockage, beware. So I lost a significant amount of weight. I looked entirely different. I had scars across my abdomen. I've got a very light port scar here that I was quite worried about at the time. That relationship has really changed. An ileostomy, that was really tough to adapt to, body image wise. And it felt like largely people just wanted to wave it off, to not allow space to have those conversations, to tell me that it wasn't important and to focus elsewhere. But it left me feeling, I think, really alone. And then post-treatment, when I was able to eat again, and when I was on steroids and all these other things, and the weight bounces back up and is somehow beyond where you started, boy, is that really lonely too, and just can fill us with shame and worry about like what our bodies and what we can't control in them might reflect of our exterior life. So again, what can health professionals and systems do? Exploring beyond the obvious of cancer and the expected challenges, more supports for long-term challenges. Considering how age, gender, race, culture, sexuality, and other factors might impact an AYA's experience. So again, having this like critical lens to some of the existing resources that are out there, we don't want to make assumptions as to like what may or may not carry the most emotional weight for somebody in their changing bodies. We don't want to make assumptions based on norms as to like, oh, like women are supposed to have long hair or what have you. We want to meet people where they are at and what they want for their bodies. What's YAC been doing here? Oh, goodness. You can see my copy paste action and work there. So YAC again does a ton of work on the issue of body image. This is something that we talk about very regularly within our chats, within our retreat programs. And again, just trying to normalize an experience that people often have thought about in just one specific way as to like what cancer may look and feel like. Sorry about that copy paste error. Let's talk now about fertility. So only 52% of young adults have had a conversation about fertility preservation with their healthcare providers. Wow. So with our study, we took a slightly different approach when approaching this topic of fertility with the participants. We wanted to look into the prevalence of fertility preservation knowledge, discussions, and engagement with young adults with cancer, and specifically to explore this relationship with these variables with later post-traumatic growth. So what did we find? We found that in 81% of those that reported awareness of risk about how cancer treatment could affect their fertility. Oh my goodness, let me just take that again. So 81% of our participants reported awareness of how risk of their cancer treatment can affect their fertility. 52% discussed fertility preservation and 13% pursued fertility preservation. So post-traumatic growth was higher for those with knowledge of their fertility risk, but did not differ between those who discussed fertility preservation versus those who did not, or made arrangements versus those who did not. So those who did not go forward with fertility preservation because of their own choice or their doctor's recommendation not to delay treatment reported significantly higher post-traumatic growth. This strongly suggests that when young adults are aware of all of their potential risks, they feel better equipped to make the very best decision for themselves and also cope with better outcomes, and also cope with these outcomes. So at the age of 29, I was diagnosed with cancer and I was given the option of preserving my fertility, but was told that it would delay my cancer treatment. It was the most difficult decision I've ever made in my life, and I don't think I've ever cried as hard, but I decided to forgo fertility preservation. I felt that I needed to give myself the best shot at survival and was worried about the toll fertility preservation would have on my body prior to starting fertility treatments and on my body prior to starting chemotherapy. I do not regret my decision, but sometimes I wonder where I'd be if my decisions were different. So this is from an anonymous community member diagnosed with cancer at age 29. Those conversations are so hard, so complicated. The choices feel impossible and unfair. And often this is happening at the very most acute phase of when everything is happening. So what can we do? We need to have these conversations, even when time is short and choices seem obvious. Empower AYAs to make informed decisions for their care. Approach these conversations with curiosity and openness. Do not make assumptions and challenge heteronormative scripts and resources. That is something that comes up very often in our community, again, that perhaps their sexuality was being guessed upon by their provider, or what their wants and needs were around fertility preservation. We have to explore these things. What has YAC been doing? I find that the biggest thing that we do is we hold a lot of space for grief. We empower community members to ask questions about their fertility needs. We connect them to one another. This grief piece is I would say, the biggest piece that we carry when we're having these peer conversations together. Grief around the loss of choice, around how expensive these options may be, around not even getting to decide whether or not you wanted that before that decision may have been taken away. So much grief to carry there. And again, a kind of grief that often is loaded with shame or doesn't have appropriate resources to hold it. Financial toxicity. Okay, so we know that cancer and money is a huge thing. At least I hope that folks recognize the impact of a cancer diagnosis on our financial health. And for young adults, this is especially true. 50% of young adults were off school or work for 1 to 3+ years. We know that money can be a significant stress factor in one's life. Young adults with cancer often find themselves in a precarious situation. They're too young to have a chance to save money and too young to have also made significant contributions to pension programs. Often they don't have jobs with financial security or health coverage or long-term or short-term disability. Many are still in school. They're looking for their first job, starting a family, moving into their homes. They're starting to try on independence, and this makes them really vulnerable. And cancer often means that we have to change and reorganize these plans entirely. For example, many of us have to pause our education, take sick leave, when we find ourselves unable to return to work or having to live off of income support programs through government or private insurers. Our study found that 35.4% of the sample quit work or school completely. That's a third of young adults in our study diagnosed with cancer that are in that situation. It's a common misconception to think that healthcare in Canada has no costs for Canadian patients, and the costs are numerous, from travel to the hospital, parking, and non-covered medication. It's very costly to go through cancer. And we've heard so many stories from our community on the financial strain. We felt like the financial health of young adults with cancer was really negatively impacted compared to their non-cancer peers, but we really needed to explore that to know what the case was. So within the YACPrime study, this was the first Canadian study to explore the financial impact and recovery with a large sample of young adults with cancer. And the results showed us a deep and lasting impact on our finances, and they have extended periods of no or lower income, increased medical expenses, bad debt, and fewer assets than their non-cancer peers. So some of the findings: 70% missed at least 6 months of work, 50% missed school or work for 1 to 3 years, 60% spent at least $100 a month on cancer-related expenses. When comparing our young adults with cancer with their non-cancer diagnosed peers, we saw important differences. Income has a really strong relation to physical quality of life. And we found that those earning less than $40,000 annually were 8 times more likely to report poor physical quality of life than those earning more than $80,000 annually. Those findings should be interpreted with caution, like knowing that the Canadian median annual income level in 2018 was $61,000 a year. With inflation right now, we're certainly feeling the hurt on our community, and hearing that often suggests that, individuals were living in poverty and are probably struggling to maintain basic standard of living for themselves. Even some government support programs available within Canada, survivors of young adults are not always eligible for these things. They're a really vulnerable group. Addressing this issue is really crucial to how we think about recovery in a more holistic way. So how do we financially recover from these lost years, from this experience? So what can we do? Don't wait until a crisis is identified to involve social work. Get the supports involved early to identify what might be there. Continue to assess and explore financial well-being over time. So don't just have this conversation once, keep checking in on what this may feel like. Again, this is a healthcare naive population. So this could be folks that are entering in saying, I guess I've heard that healthcare is largely free. Maybe we'll be okay. I don't know. We got to keep checking in and seeing how this population is doing over time. We need to advocate for social support programs that do not exclude AYAs from access. So just yay to potential EICC changes and extending that from the federal level. that was really exciting to read about. I don't have much more to say on it because it's so new, but I'm just thrilled to see that potentially coming. Again, what have we been doing? We make sure that our programming is entirely cost accessible. So making sure that we've got support programs for folks if they're journeying to us in person, to be able to help them get to us that way. For anything that we offer online, that is 100% free. We regularly feature resources and support across our programs on financial toxicity as a theme. I want to talk finally about number 8, which is the power of connection. And so we've talked a lot about, I think, some really hard and heavy things for young adults experiencing a cancer diagnosis. And if you are somebody in the audience that that's your reality and you're hearing this and it's like, whoa, just please know that there is things that we can do here, that as hard as it is, we can support each other. And so through the power of connection, those that feel connected to the young adult cancer community have less distress and better overall mental health. Isolation is one of the main issues faced by young adults with cancer. For over 20 years, YAC has been working to be the bridge out of isolation, creating and nurturing a community to help, support, inform, and inspire. In 2006, Dr. Brad Zebrak found that young adults want the support of other young adults with cancer more than they want support from any other group. Parents and friends are still important, of course, but they ultimately want and need to connect to their peers with cancer. And this is the focus of our mission as an organization. We strongly believe that those who get connected to those who get it, that this can have a huge difference in their lives. To support these statements with evidence-based data, we wanted to know, what was the impact on our people that were connected to YAC, that were connected to the cancer community. And those that were connected to the young adult cancer community had lower levels of distress, better overall mental health, less body image distress, a positive effect on emotions, cognition, and behaviors that are considered beneficial to health. We found that this sense of belonging, connection to a community of peers can have a really positive effect on the emotions and just kind of holistic well-being of our individuals. And those that weren't connected to the young adult community tended to have less adaptive coping methods. And sometimes these coping methods were even, maladaptive, as we would term them. So that might include substance use, avoidance, behavioral disengagement. The normalization that comes with peer connections is critical to AYA's healing and recovery. The YACPrime data shows us the importance of social support, and YAC's mission will always remain focused on this. So that's from Dr. Norma D'Agostino, who is an incredible colleague. She's a psychologist at the Princess Margaret Cancer Centre and a member of our board. The power of connection. What can we do? Refer to us. That's a clear shout out. So come find us. But there are also so many other amazing organizations in the AYA space doing wonderful work. I clearly have a bias here, but making sure that folks know that there are options available for support out there to find that peer connection in a safe way. Revisit peer support, even when the hard stuff, that acute treatment stuff that we often throw the most resources at. That can be a lot of overwhelm at the beginning when you're getting every pamphlet. I know I had a scary doom bag of pamphlets I didn't visit. And so revisit these resources over time. Could even be when treatment has wrapped is when we're doing the revisiting. So what has YAC been doing? This is what we do. So I want to very briefly just shout out some of the things that we've got going on as an organization. I talked about the chats program earlier. That's where I spend a lot of my time. And I just have a true, I think, internal bias towards that program. So please refer your patients our way. We also have specific chat programs for community members that are 2S LGBTQI+, as well as those living with advanced and metastatic disease. We We have a private Facebook group. I took a little screenshot, and the names you can see there are just of my colleagues, actually, of like an earlier in life post from me, like worried about like polyps and wanting some support from my community. And like that was such an important thing to be able to do during those like 2-3 a.m. Google searches of like, oh gosh, what's going on? There's a program called YACC, which happens every other Friday, which is a little bit more informal social support. We've got web series. We've got this amazing group of volunteers called Insight that guide us. We've got the Big Cancer Hookup, which is like a big kind of talk show that we will run for our community. The amazing faces that you may see on your screen in front of you are activists that help kind of create and drive content for our website and community that reflects the young adult experience for many people that may mostly connect with us online by reading about other folks going through something like them. These are some of the programs that we have historically run as well in person that we're excited to get back to in time. So the Survivor Conference, Retreat Yourself Adventure, these like 4-day away adventures for our community to connect. And then I finally just want to shout out our next biggest program that is in the future there. So launching on World Cancer Day and running for about a week. Survivor Conference is virtual. So please feel free to join us, to register for free online. It's open to folks, again, with a lived experience of cancer before the age of 40 that are currently between the ages of 18 and 39-ish. So shouting that out. If you want to find us, youngadultcancer.ca or connect at youngadultcancer.ca. Thank you so much for being here. You could screenshot that from my email address. I'm not very hard to find. Thank you so much to our hosts here today. Thank you so much to all of the participants and researchers that helped us to reflect these realities through our evidence. And thank you for making space to be here today. I so appreciate it as somebody that was a part of this research as a participant. So it's kind of interesting to be here on the other side, doing some of the knowledge translation pieces. So questions, I guess, Trevor, right? Is that where we are?
Yes, we have. Thank you very much, first off, for an amazing talk. It was a very, very good discussion about this kind of topic that, as you say, is very looked over, because usually we assume that lots of cancers are later in life, but of course, as you described, that is not the case. We do have one question so far. Meta says I found that 13% is really low for individuals to seek fertility preservation. And even though it is a personal choice, is there a reason that you have found that the numbers were that low at 13%?
Awesome. Great question. So I don't have a particular research or information from the data to point to, but I can point to just from I guess my observations as a clinician and as a member of this community. Often it can be the pressures of treatment. It can be the pressures of we need to start right now. Many young adults, their disease is discovered kind of late when things are advanced and advancing quickly. So there's a lot of rush to we got to go. We have to move aggressively. So I know that's the case for many folks in our community. Realistically, financial barriers are huge for this. So, and this will vary from province to province, but the costs are not inexpensive. So I was one of the lucky 13% that was able to do fertility preservation. And this was before some programs were introduced in Ontario. And we kind of did that through a prayer and a credit card, I would say, and a couple credit cards realistically. So that costs between $10,000 and $15,000 when, again, I was a student, I had no EI, I had nothing. It was just something we were doing to scramble. And we got lucky that I was on the right day of my cycle because my team was excited to get moving towards treatment. I continued to carry financial cost related to that. So there's I call it my rent on my eggs to kind of keep them around. So cost is a really big barrier there. And then for many folks as well, I do think that the conversation of fertility preservation is just scary on an existential level. If you are 19 years old and you're being asked, do you want to have kids yet? I don't know. Do I want to, is that something we can afford to do? Is that something I want to do? Do I talk to my partner about it? I don't know. So it's a really scary thing to confront folks with on the fly. So I think it's really multifactorial as to why it is the way it is. I'm curious to see more research on the other side of it for folks that have had fertility preservation, like how many folks do end up being able to access like care for potentially like carrying children or surrogacy or whatever of those pathways might look like for them. That's future questions that I'm personally curious about. Thank you, Amanda.
Mm-hmm. Now, one question that I personally have is that with YAC has been expanding a lot over the years, especially considering that it's a very important again, important part of the cancer conversation. What other areas are you looking to expand into? For instance, are you thinking of doing more support groups, or do you think that the best thing for you guys to do is just to get the word out there to kind of to tell people with cancer, young people with cancer, that they aren't alone?
Great question. So we certainly are in a period of expansion. I think COVID has been very transformational for our organization, as it has been for many, as far as like how do we deliver programs and how do we connect with our folks and bring them together for support and education. And before COVID, a lot of it was in person, be it through local programming, through Local Life, which I don't know if I shouted out before, but it's in a couple major Canadian cities that does more kind of fun events. And then these like larger things where people would have to get away from it and do. I like the peer support piece is really important. I think we're hungry to get into a little bit more like ongoing educational content or like maybe closed group content. There's a lot of areas that we're able to go now with the virtual pieces, and we're also able to serve people in a different way. Something that I've been really excited by as a facilitator is that like folks are now able to like join us from their hospital rooms. They're able to join us like on their like hardest days and just say like, hey, I'm camera off today. I just need to be here to listen. I also find that like our community is a wealth of knowledge. This lived experience is hard won. And there are so many things that you don't know until you get there, as far as like, who am I supposed to talk to about this? Or how am I supposed to do that? And so that's one of my favorite things to watch within our community as well, is just like the capacity build across the community and across individuals from this lived experience.
All right, well, I don't see any questions as of yet, but just a little bit of housekeeping before we wrap things up. The slides will be available for download on our slide share as of tomorrow, and a copy, once again, of the slides and of the video will be sent out to everyone with the email that you registered. And also don't forget to sign up to our to our webinar email as well, because we have a lot of stuff coming up in the new year. But this is the final installment of the 2022 season. So thank you, Dani, for capping things off in a fantastic way with this talk. And yeah, if I don't see any other questions per se, I think that we can wrap it up. So thank you very much for everyone for attending the webinar series, especially if you've been attending the entire year round, and keep an eye out for our series coming up next year. And I would like to thank you, Dani, for a fantastic talk and a very much needed talk as well.
Thank you so much. You can also, the slides, if that's not the best way to take in information, if you head to youngadultcancer.ca, it's like right on our homepage right now, you can click that through for like more of this information available. We're all about making sure this knowledge gets out there into our community. Thank you so much, Trevor. And thank you so much, everyone, for being here today.
Yeah,
excuse me, I wonder, Trevor, if you could read my chat. I put some information in there. Because of the sleep.
Yes, about the Department of Psychology, Memorial University. Yes, okay. They hosted a project for those who have had or had cancer and trouble with sleep patterns. This took place over the period of almost a year, and within the first week or so, you had an improvement. PhD student was actually Torbera NFLD, and thankfully Wi-Fi was fine as well as in PI. Met weekly at first, then monthly to follow up, and in between the coordinator of the program did assessment with you periodically, which is quite amazing. Yes, well, worth the experience of 2 of the friends that participated with success in breaking the poor quality of sleep, etc. and they hope to offer this again. Yes, we will definitely be looking into that. And thank you for bringing that to my attention. We'll definitely be looking into that as well. Perfect. Thank you very much, Judy. And once again, thank you to everyone for attending the webinar, and we will definitely hope to see you very soon. So thanks, guys.
Thank you, everyone.